my name is Renee. I work at the Possums Clinic as a registered nurse and lactation consultant. I will start before just honouring Dr. Pamela Douglas, who is a GP at the clinic, also the medical director of the clinic, and a lot of her work goes into the information that I've got here for you today. So the clinic itself is just located up in Highgate Hill. It's a medical practice. We have a whole group of GPs, paediatricians, allied health professionals and lactation consultants. We specialise in the care of parents and babies. Childhood development and mental health is a big component of what we do. We also do obviously offer general practice as well. When you have your baby, and if you've had a little one, you probably will soon realise that it's a whole big world of conflicting advice out there, and that from some things people say are almost the complete opposite to what someone else will say. And we think, where do we go? Who do we listen to? How do we know what to listen to? What feels right? So at Possums, we sort of guide you along that path. What makes us a little bit different is that we're in fact not-for-profit. Our services aren't to raise money for ourselves. Our services are focused on trying to get the advice, the evidence from the research across to families. We're evidence-based, as I said, and affiliated with the University of Queensland and Griffith University. Dr. Douglas, as I said, who set up the clinic, also is a researcher herself. The programs that we run, we also have ongoing evaluation of those programs. I think one of the biggest topics that we see families on is sleep. So a couple of things that I'm just going to run over are things that you may have heard the exact opposites for. And that's why I'm telling you here now that, you know, they are controversial and there are people on one side, but as I said, I'm presenting what the research is telling us now. In this area, you know, the treatment for families in these early days is somewhat 17 years behind the research for some of the advice that's being given. And there's no other area in the medical practice that it's so far behind. So really, this is what the evidence and the research is telling us now. Baby sleep needs are incredibly varied. There are not set amounts of sleep that babies at a certain age should be having. It is very individual. And as the graph says, that in studies that one baby could be having 9 hours total in a 24-hour period, and the baby next to them that was born maybe the exact same day has double that, 18 hours in a 24-hour period. And they are both normal. They are both going to, you know, not have any issues with development later on, that is very normal. And so when we know that, we know then that we can't prescribe that your baby will have this much sleep at this much time and be awake for this certain period of time, that it's very much individual for your baby. We have a sleep program that we offer families who are having nights that aren't manageable. The focus is on enjoyment and making life easier. We talk a lot about the clinic of dials, having our stress hormone dials turned up and down. Our programs are very much focused on turning those dials down, working with the fact that your baby has varied sleep needs and having days that are manageable and enjoyable. Feeds is another area that you quite often will hear different conflicting advice about how we're feeding, how often we're feeding, all sorts of different things. We know that with not getting the feeding right, that is quite often the underlying issue that we start seeking advice for other areas. So fit and hold, when we talk about fit and hold, it's a way that the baby's held at the breast, the way that they're fitting to the breast. That problems with that are often not picked up and missed, and what they do cause is a lot of crying and fussing, marathon feeds, which is feeding all day, all night, excessive waking at night, and of course the nipple pain and mastitis. These, as I said, are symptoms of poor fit and hold are often overlooked. We go seeking for other diagnoses for what's going on. At the clinic we use an approach, the Gestalt breastfeeding approach, which recognises that every woman's body is different, every baby is different, and we experiment and we work with ways to get the right fit and hold for that mum and baby. This is really controversial. that we have a very much increased diagnosis of reflux and different types of reflux. But the evidence tells us that the reflux, and when we say reflux, it's stomach contents that come up in the esophagus, that for babies, in fact, it's not at all acidic for at least 2 hours after the feed, so that doesn't cause pain for them. Allergy, we know, is a big issue in the community at the moment, and that too is quite often diagnosed as a reason why a baby might be fussing, why they might be crying a lot. The most common is a cow's milk allergy, but what we know is cow's milk allergy causes rashes and sometimes some blood in the stool. It doesn't cause crying. A common thing that's overlooked and often diagnosed as allergy is something called functional lactose overload. And that causes a baby to have the big bloated tummy, lots of wind, really frothy poos, and very frequent feeding. We know that this is a problem of not enough cream, so it's a breastfeeding management problem. It's not a problem of reflux or allergy. Tongue tie is a huge topic too at the moment. At the Possums Clinic, we do perform oromotor and tongue function assessments on all babies, and those that are diagnosed with a classic tongue tie, treated with a quick simple frenotomy. But after that, they're given a Gestalt breastfeeding support, as I was mentioning before. And we find with that sort of management of feeds that babies don't need that very deep cuts, the laser surgery to the upper lip, and the posterior tongue ties. So that's something very unique about our clinic, and especially in the community at the moment with the diagnosis of tongue tie, that we really can work with different positioning to get breastfeeding happening. When a baby's crying, we often describe them that they're in pain. And that's sometimes what then leads us down that track to a diagnosis of a medical condition. But we know that babies, and as I was saying before, that dial, babies that have their central nervous system, sympathetic nervous system dialed up, do look as if they're in pain. They do bring their knees to their chest. And when I talk about sympathetic nervous system, that's that stress hormone release, like that fight-flight response. If they've got that stress release, so stress hormone release dialed up in a baby, and usually they'll get dialed up and down throughout the day. But if we've got a breastfeed that the baby's able to relax with and have that wave of the feel-good hormones that they emit when they have a feed, just like mum does as well, that wave dials that dial down. So babies that are having issues and not having the optimal fit and hold at the breast quite often have that dial etched up a little bit. And they're the babies that can sort of go 0 to 100 really quickly and look like they're in pain. But we've shown that there is that sympathetic nervous system dialed up. Crying, we all know that babies do cry, and how much and what's normal. On average, 2 hours a day in the first 6 weeks. Just over an hour by 12 weeks, and then at 16 weeks it really tapers off. So sometimes families just knowing that at 16 weeks, things will start to get a bit easier and there'll be a bit less crying. But we know through the research and through the programs we do, there is a lot that can be done. And in fact, early studies at the clinic is by 50% reducing those. And it's just using some of the tools and the interventions that we do surrounding cued care and cueing into your baby. At the clinic, our aim is to make your days as easy and enjoyable for you and your baby. And so what's best for you is best for your baby. We talk a lot about the clinic, about having your parenting values, and when I was talking about that first slide about all that conflicting advice and who do you listen to, which way do you go, we would direct you to be guided by your parenting values, where you sit, what sort of parent you want to be, and experimenting and trying things, but being comfortable to say that doesn't work for us, that's for somebody else, we'll draw on and we'll try something new. We encourage you to experiment for yourself, and that's something that is unfortunately quite controversial, because a lot of the advice you may receive is very prescribed and very strict and very much based around routines, where we would encourage you to experiment, and if something's not going well, something's not working, then you abandon that and move on to something different. You don't need to keep pushing through on something that you don't feel is working for you. We aim for workability. We don't aim for perfection. We aim for workability. What works for you and your family and what enables you to have an enjoyable day. Most of what I'm talking about and some of the programs we run are covered in 2 books that we're selling over at the clinic, and they're written by Pam Douglas, as I said, the GP, and Dr. Cole Whittingham. Some new programs that we're offering at the clinic are a 2-hour information session for parents-to-be, and that's just about caring for your baby when they come home. So it's not covering topics about the birth, but really about getting those feeds right, knowing how to keep that dial turned down, cueing into your baby's needs. And we also have a day stay program for those families that aren't managing with sleep, a day stay where they can come into the clinic, stay for the day, see a range of different health professionals there, and be able to take away from that day some strategies to get through the nights. In a nutshell, don't follow the rules, follow your baby and your own joy. It's all about enjoying this period of time. Thank you.